Welcome to Nursing Edge Unscripted Saga, as we use stories to connect the past to the present and then our future as we reimagine our teaching and learning. As we celebrate the NLN Year of the Nurse Educator, we pay tribute to extraordinary nurses who've made significant contributions to nursing education. We dive into the stories of nurse educators who recognized a need, challenged traditional customs, and influenced transformative change. Over the past 9 months, we have highlighted the remarkable contributions of an extraordinary group of nurse leaders who were instrumental in the National League for Nursing Education reform effort, also referred to as the Curriculum Revolution. These reformers, through their combined endeavors, brought nursing education into a new, more modern era, one that questioned long-standing traditional pedagogies and allowed for the creation of visionary ideas and forward-thinking innovation. This month, we celebrate the contributions of another prominent nursing reformer, Dr. Luther Christman. Throughout his nursing career, Dr. Christman was a tireless advocate for the hiring and training of male and minority nurses, as well as a pioneer in the advancement and elevation of nursing education. He was the first dean of the Rush University College of Nursing, where he developed a new educational model that promoted a unified pedagogical approach to nursing education, combining academia with clinical practice. This groundbreaking work not only established Dr. Christman as a nursing leader, but it set a new standard for nursing education both within the United States and abroad. Dr. Christman may best be known for helping to establish the National Male Nurse Association, which ultimately became the American Assembly for Men in Nursing in 1981. Dr. Christman was born on February 16, 1915, in Summit Hill, Pennsylvania. The oldest of 5 children, he grew up in a small town. Once he began attending school, he developed into a voracious reader with a passion for learning. In fact, Luther's town librarian once commented that he checked out more books than anyone else she knew. After graduating high school, Dr. Christman had few prospects, given the economic landscape of the Great Depression and his own family's financial situation. Unable to find steady employment, a local minister suggested that he pursue nursing as a profession, since at the time, students not only worked for their training, but were given a small stipend. This made nursing education a feasible option, not only for himself, but also for his high school sweetheart, Dorothy Black, whom he intended to marry. So Luther and Dorothy soon moved to Philadelphia, Pennsylvania, where they each enrolled in a nursing diploma program. He at the Pennsylvania Hospital School of Nursing for Men, while she studied at the Methodist Hospital School of Nursing. Dr. Christman graduated from nursing school in 1939 and married Dorothy the same year. As a new graduate nurse in a profession mostly comprised of women, Dr. Christman soon discovered what it meant to be part of the minority. Having been denied admission into a local university's nursing program, as well as entry into the Army Nurse Corps, Luther enlisted in the Merchant Marine, where he became a pharmacist mate, first class, during World War II. During his time as a merchant marine, Dr. Christman wrote numerous letters to U.S. government officials, pleading for them to allow men to serve in the military as nurses. In one such letter, he wrote, quote, "You may be unaware that men nurses are not accepted by the armed forces in their nurse corps. We men nurses feel that this discrimination is unjust and unwarranted. During this crisis, the armed forces should avail themselves of our skill and experience. If given the opportunity, we are able and willing to serve to the best of our ability. We feel that we can make a definite and valuable contribution to the war effort if our status is recognized," end quote. Yet, despite Dr. Christman's best efforts, men continued to be denied the opportunity to serve in the Army Nurse Corps throughout World War II. In fact, this policy was not changed until the 1960s, when the military finally allowed men to be commissioned as nursing officers. Following the war, Dr. Christman left the Merchant Marine, enrolled in a university nursing program, and ultimately earned his baccalaureate degree from Temple University in 1948. He then went on to secure a teaching position at the School of Nursing Camden Hospital in Camden, New Jersey. Thus began Dr. Christman's journey in academia, a setting where he would have a significant impact, earning a reputation as a visionary leader, as well as a champion for the advancement of nursing education. Yet several of his ideas were controversial, causing some to view him as an educational maverick. Please join us for part 2 of this series, where we will further explore Dr. Christman's career in academia, his many contributions to the nursing profession, and his lasting influence on education. And so the saga continues. And may our saga continue as we bring to a close this episode of Nursing Edge Unscripted Saga. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.